illness is often a blessing. No man who has never been ill can have a thorough knowledge of himself and the world.
Actually, I had gone to hospital for some other physical ailment, for some ultrasound of the stomach and all that. So when that was being conducted, some young doctor was there and she just asked me, have you got mammography done ever? So I said no. Then she said that at this age, though, the ladies, they should get the mammography done every year. So why not to have it now? So I was a little reluctant, but her voice was so concerned. Then she said, why not to have it just now? I said, okay. She got the mammography done. After that, sometime I went there to collect the report. I was a little upset. What has happened? I was sure that my report will be okay. He told me that please don't get upset. There seems to be a lump in your left breast. It seems to be malignant. I will do the needle test further to make it more confirmed about it, but please be prepared for it, and it is malignant, and then you have to get it operated. So anyhow, it was a little bit shocking news for me, but I kept this news to myself only because I never wanted to upset my family members. She examined me and then she sent for MRI, and in the MRI, luckily, the size of the lump was a little lesser than the palpable size. So I think palpable size is that if it is slightly more than that, then they have to do the complete surgery of the organ.
Conserving an organ or a function is very, very important for psychological well-being of the patient. If a patient's breast can be preserved, she feels a complete woman. If her voice is preserved, at least she is able to communicate with the people well.
After initial radiation, I lost my voice for some time. मैंने कहा बाबा कैसे चलेगा ये? बेटे तू चला जाएगा तो मैं किससे कम्युनिकेट कर पाऊंगा कि मुझे ये चाहिए क्या होगा? देन डॉक्टर दत्ता से मैंने ये होता है, धीरे धीरे वॉइस जो है वो आने लगेगी.
We want to retain now the structure, the organ structure and function with new strategies, and these new strategies are evolving by the day, and one does not have to be absolutely radical to treat or cure the cancer. In case of kidney also, at one time it had to be removal of the entire kidney, this kidney cancer. Now if there is a small cancer in the kidney, only part of the kidney is removed, and you preserve the function of the kidney as well as the structure. So basically, I think it's a step forward.
In my case, chemotherapy was not to be done. For about 2 months or so, radiotherapy sittings were done, and after that, I think I was quite normal, because that trauma of getting the hair loss or the organ loss, all that was not there. So all these positive things were there.
Overall management depends on the stage of disease. For all solid tumors, it all depends on stage of disease. As I said, most of our patients are locally advanced. About 70% come in advanced stages and 30% are in localized diseases. and these 25-30% of these patients may require either with radiation alone or with surgery.
Now, if one side you look at the various global and the national cancer control program, one of the most essential component of these programs is for an early diagnosis of cancer.
Get yourself tested earliest. Don't delay. निकलेगा, नहीं है तो नहीं है तो treatment. But don't suffer because of delaying the detection.
Now, if a patient is diagnosed early, he certainly needs to be treated. And if he needs to be treated, he needs to be treated effectively. Today, the modern medical science has been able to not only treat these patients, cure them with perhaps a better quality of life. And this better quality of life can only be achieved if you can preserve their organ structure and function. And that is why it is very essential that all the clinical specialties of either radiation oncology, medical, surgical, radiodiagnosis, nuclear medicine, and even other diagnostics tools that we have at this point of time work together.
Integration of medical oncology at what point of time will depend upon what case it is, what stage it is, and what treatment the patient has received earlier.
Nowadays, the concept has changed again. The concept of my patient or my treatment to our treatment.
I see the future of cancer treatment very, very, very encouraging. The reasons are that we are able to understand the process of cancer much better, and with the advancements in technology and in research, that time is not very far when each individual cancer patient will be treated individually. What I'm trying to say is that it will be a personalized, tailor-made treatment for each patient, because as we know today, you give the same drugs for the same cancer in different patients, but the drugs work differently. Why they work differently is because everybody is an individual. They can metabolize the drug in different ways, and they have different pathways which are actually responsible for that cancer.
The functionality of the organ, is really a miracle of medical science, but it is also a miracle of how to make use of the medical miracle.
Metabolic imaging with PET-CT plays an important role in radiation treatment planning. It helps in improved and precise contouring of tumor volumes, resulting in saving of non-tumor area from being irradiated. In fact, it can alter the treatment volume between 15 to 60%, resulting in improved and precise dose delivery to the target.
Well, this is the future, and once that comes in, then I think nearly every patient will respond to the treatment that is being given to the patient.
हमको इतने अच्छे लोग हैं, इतनी काइंडनेस है दुनिया में, इतना कंपैशन है, इतने हेल्पफुल लोग हो सकते हैं, इसका पता नहीं था कि the best in human beings asserts itself when they found a fellow human being in trouble. तो ये आप लाइफ को नए सिरे से देखते हैं, तो वो जो डार्क टनल है ना, उसमें लाइट्स आने लगती हैं. The tunnel gets lightened, with every such gesture of kindness, compassion, and helpfulness.
I am in the hands of experts. So medicine is also going on. For 5 years I have to take that medicine every day. But anyhow, with all this, I'm thinking that I will be able to lead a very happy and comfortable life for another many years.
It helps to remove the phobia in the minds of the patients that, well, cancer means a death warrant. Cancer means that you have to sacrifice a body part. No, it's not that. So this is the message that we would finally like to convey through this international conference, RGCon 2010.